Advanced Heart Failure Therapies. Welcome to this in-depth presentation on advanced heart failure therapies. In this video, we will explore the latest interventions for patients with severe heart failure, including mechanical circulatory support devices and heart transplantation. Our goal is to provide a clear understanding of these life-saving therapies, their indications and contraindications. Let's begin. Learning objectives. By the end of this video, you will have a comprehensive understanding of the Impella device and its role in short-term cardiac support, extracorporeal membrane oxygenation, or ECMO, and its applications in critical care, left ventricular assist devices, or LVADs, and their use in long-term heart failure management. And finally, heart transplantation, the gold standard for end-stage heart failure. Let's start with the Impella device. Impella. The Impella device is a percutaneous mechanical circulatory support system used in patients with severe heart failure, cardiogenic shock, or during high-risk percutaneous coronary interventions, also known as PCI. This small, catheter-based pump is inserted through the femoral artery and advanced into the left ventricle, where it assists in unloading the heart and maintaining cardiac output. Absolute contraindications. Despite its benefits, the Impella device is not suitable for all patients. Severe aortic valve disease, including aortic stenosis, with a valve area of less than 1.0 centimeters, or severe aortic regurgitation, where the device may worsen backflow. Left ventricular thrombus, as Impella use can dislodge the clot and cause systemic embolization. Mechanical aortic valve, due to potential device interference or valve damage. Severe peripheral arterial disease, preventing safe femoral artery access. Active systemic infection, or severe bleeding disorders, increasing the risk of complications. Ventricular septal defect, VSD, which may worsen left to right shunting. Relative contraindications. In some cases, the use of Impella is possible, but requires careful consideration. Moderate aortic valve disease, which may require additional imaging before placement. Mild to moderate peripheral arterial disease, which might necessitate alternative access sites, such as the axillary artery. Right ventricular failure, as the Impella only supports left-sided function. In such cases, additional support with an RVAD may be needed. Severe thrombocytopenia, increasing the risk of bleeding. Recent stroke or intracranial hemorrhage due to concerns over anticoagulation. Severe renal insufficiency, which may worsen with contrast exposure during device placement. Small left ventricular cavity, which can make positioning the device challenging. Now let's move on to ECMO. Extracorporeal membrane oxygenation. Extracorporeal membrane oxygenation, or ECMO, is an advanced life support technique used for patients experiencing severe cardiac or respiratory failure. It temporarily takes over the function of the heart and lungs, allowing time for recovery or transition to a long-term support device. However, ECMO is not suitable for all patients. Absolute contraindications. Irreversible organ failure, such as severe brain injury, end-stage liver failure, or kidney failure where dialysis or transplant is not an option. Uncontrolled bleeding disorders, as ECMO requires systemic anticoagulation. Advanced malignancy, where life expectancy is less than 6 months. Severe aortic dissection, which can be exacerbated by ECMO flow. Irreversible heart or lung failure without a plan for transplant or long-term support. Relative contraindications. ECMO can be considered on a case-by-case basis in conditions such as prolonged cardiac arrest with ongoing CPR, though outcomes worsen after 60 minutes. Severe obesity with a BMI greater than 40, which increases complication risks. Chronic organ dysfunction, which may worsen with ECMO. Active infection or sepsis, which raises the risk of secondary infections. Recent major surgery or trauma, where the risk of bleeding is heightened. Next, let's discuss left ventricular assist devices. Left ventricular assist devices, LVADs. Left ventricular assist devices, or LVADs, are mechanical pumps that help maintain circulation in patients with severe heart failure. They are often used as a bridge to transplant or as destination therapy in patients who are not transplant candidates. Absolute contraindications. Patients who are not candidates for LVADs include those with irreversible end organ dysfunction, such as advanced kidney or liver failure, severe neurological impairment, where managing the device is not feasible, active systemic infection or uncontrollable bleeding disorders, fixed pulmonary hypertension, which increases right heart strain, cancer with a poor prognosis, relative contraindications, advanced age over 75 years, severe obesity, which complicates surgery, chronic kidney or liver disease, history of non-adherence or substance abuse, which may require additional support before implantation. Finally, let's discuss heart transplantation. A heart transplant. A heart transplant is the definitive treatment for end-stage heart failure. However, it is reserved for select patients who meet strict eligibility criteria. Absolute contraindications. Irreversible end organ dysfunction, including severe kidney, liver, or lung disease. Active systemic infection or sepsis that cannot be controlled. Active malignancy with a poor prognosis or recent treatment. Severe neurological impairment, including advanced dementia or major stroke. Fixed pulmonary hypertension, where pulmonary vascular resistance exceeds 5 Wood units despite medical therapy. Psychosocial instability, such as inability to adhere to immunosuppressive therapy or lack of social support. Relative contraindications. Advanced age over 70 years, though age alone is not a strict contraindication. Obesity, BMI 35, which increases surgical and post-operative risks. Diabetes with end organ damage, unless well controlled. Chronic kidney disease, which may worsen with immunosuppressive therapy. History of non-adherence to medical therapy, which may require additional support. Active smoking or substance abuse, if the patient is willing to participate in a rehabilitation program. Severe psychiatric conditions, such as major depression or anxiety, which may interfere with post-transplant care. Immunosuppression risks. Patients with a history of frequent infections or conditions that increase the risk of complications from immunosuppression require careful evaluation. For example, individuals with HIV and a low CD4 count may face a higher likelihood of infections and poor post-transplant outcomes. Because lifelong immunosuppressive therapy is necessary to prevent organ rejection, it is crucial to assess whether the patient can tolerate this treatment without significant complications. Prior malignancies. A history of cancer can impact eligibility for transplantation. Patients who have previously had malignancies are often required to demonstrate a cancer-free period before being considered for a heart transplant. This period typically ranges from 2 to 5 years, depending on the type of cancer and the risk of recurrence. The goal is to ensure that the cancer is unlikely to return before undergoing the immunosuppression required after transplantation. Summary and conclusion. In summary, advanced heart failure therapies, including Impella, ECMO, LVADs, and heart transplantation, offer life-saving options for critically ill patients. However, proper patient selection is essential to ensure the best possible outcomes. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe for more medical education content. See you next time.